Hello, I'm Dr. Victor Chen, and today's topic is God's battle plan for men's health. For those that have been following, this is the eighth of a series of God's battle plan health series. Male specific battles. Of course, male will have different battles compared to women in terms of health. Cardiovascular disease, for instance, a higher risk in men. Obviously, once women are menopausal, they catch up in terms of the incidence. Prostate and testicular cancer is unique to men. Lung and liver disease linked to smoking and drinking. Men smoke and drink more. Colorectal cancer, high incidence in men. Suicide and injuries, risk-taking behavior, stigma in mental health. Men have a higher risk of cardiovascular disease compared to women. Prostate, testicular cancer, obviously specific to men. Lung and liver disease, colorectal cancer, suicide and injuries. Women have more depression, anxiety, musculoskeletal disorders, Alzheimer's, and dementia. The number one killer of modern men, cardiovascular disease. We did a series of called God's Battle Plan Against Cardiovascular Disease, the first in this Battle Plan series. Men face higher rates of heart disease and stroke compared to women, especially in younger ages. Once a woman becomes menopausal, the incidence catches up to that of men. Risk factors include high blood pressure, cholesterol, smoking, obesity. The Bible says, guard your heart above all else, for it determines the course of your life, right? Basically, your heart is not just spiritual, your thinking, where your heart is. Heart is also the engine of your whole body, right? According to Proverbs 4:23. So regular checkup is mandatory, right? People who live long, they go for regular checkups. You don't just assume that you are healthy because you never check, you never know, right? So always keeping the tabs of your health is key. I have friends who said, oh, I don't need to go and check my heart because why? I can climb up the 10th flight of stairs, I can climb up Gassing Hill, no problem. What do you know? Mid-60s, died of a heart attack at the top of Gassing Hill. Right? This was not too long ago, one of my friends. So never assume. Regular health screenings that measure hidden factors such as cholesterol levels, blood sugar levels, your blood pressure, okay, offer signs of cardiovascular disease that you can prevent, right? You treat it and address it. Don't run away from all these signs. Cardiovascular screening in men. If you had a family history of cardiovascular disease, your dad has had a bypass, your uncle has had a stent, it's very important that you go for screening, especially once you get about 50 onwards. Blood pressure and cholesterol checks regular, okay? Not just one off, regular, are vital to detect cardiovascular risk factors early in men. Assessing lifestyle helps to identify habits such as smoking and inactivity that increases disease risk. And early intervention benefits. Timely screening and intervention can prevent cardiovascular disease, reducing illnesses and death amongst men. So other tests includes ECG and exercise stress tests. If that's positive, if you have severe family history, you can do a CT angiogram, which I have done. So true introspection, looking at oneself for risk factors, is important. Adopting a healthy diet, engaging in regular physical activity, managing stress, getting an adequate amount of sleep, and avoiding excessive alcohol consumption are essential for preventing and managing obesity and metabolic syndrome, which significantly increases the risk of cardiovascular disease, type 2 diabetes, and other health complications. Chinese say samko, high cholesterol, of course high lipids, high blood pressure, and high sugar. Okay. Number 2, prostatic health. When men enter old age, they are prone to prostatic disease such as benign prostatic hyperplasia, which will cause troubles with men in urination for men, such as urinary frequency. Because why? See, your bladder is enlarged. Your prostate is enlarged and restricting the flow through the urethra. So you don't clear your bladder as well. So you get urinary frequency, you get a poor flow, hesitancy because it takes time to start, terminal dribbling, that means the end of your urine Peeing, there's dribbling. Nocturia, you wake up more often at night. And in men, the incidence of BPH increases with age. Prostate health essentials, early screening methods. If you're symptomatic, PSA tests, okay, prostate-specific antigen, and digital rectal exams are essential for detecting prostate issues at an early stage. You put a finger into your rectum, you can feel the prostate, whether it's swollen, whether there's any suspicious lumps. Management approaches includes lifestyle changes, okay, smoke, reduce your drinking. Medications to treat your prostatic symptoms, there are a few I would share. Surgical interventions tailored to the diagnosis and individual needs. It's going to depend on your lifestyle and your age. And obviously you need to keep ongoing management and monitoring of your prostate. Diagnosis of benign prostatic hyperplasia you can do a digital rectal examination. Just put a finger to the rectum here. You can feel the prostate being enlarged or any suspicious lumps. Urine test to rule out infections or any blood in the urine, it can be due to other causes of, your symptoms can be due to other causes. Prostate-specific antigen, take a blood test. Post-void residual urine test. Obviously, you've got BPH, your prostate constricting your urethra. You're not going to void your bladder fully. Ultrasound or imaging, like MRI. Uroflowmetry to see what's the flow rate of the urine when you pee. Okay, that's the bladder. That's the prostate. It's on ultrasound, obviously enlarged. You go, they measure it, and so it's enlarged in this case. Treatment modalities for the management of BPH as per the American Urological Association. First, you've got watchful waiting and annual reassessment if the symptoms are mild. Medical therapies include alpha blockers like alpha-socin, doxazosin, tamsulosin, terazosin, and etc., etc. Then you've got the alpha reductase inhibitors like dutasteride or finasteride. Then you've got combination therapy, alpha blocker with 5-alpha reductase inhibitor or alpha blocker with anticholinergics. Then you've got complementary and alternative medicines, which I will share in the subsequent slides, the herbal treatments for prostate. Minimally invasive therapies like transurethral needle ablation, or called TUNA, transurethral microwave thermotherapy, okay, just to burn down the size of the prostate. Then you've got surgical procedures like open prostatectomy, transurethral holmium laser ablation of the prostate. All these you can check with your doctor. Transurethral resection of the prostate, transurethral vaporization of the prostate, transurethral incision of the prostate, etc., etc. Herbal treatment for BPH. Saw palmetto is very common. Saw palmetto is a herbal product effective in the treatment of benign prostatic hyperplasia syndrome. This active compound comes from the dwarf palm tree in America. Studies have shown that it's effective in reducing the symptoms of benign prostatic hyperplasia. Reducing the symptoms, those mild cases. Soy palmetto is similar to the drug finasteride. Okay, it's alpha reductase inhibitor, right? It's like finasteride or dutasteride, but it's more acceptable to patients and cheaper. Probably less side effects. And it's also used in the hair loss shampoo because same thing, right? Finasteride is for prostate as well as for hair loss. So the saw palmetto, being an alpha reductase inhibitor, is also used, besides being useful for prostate symptoms, is also useful for hair loss. Saw palmetto, there have been no reports of saw palmetto interacting with other medications, and its side effects are few and far between. The active ingredients of the plants are sterol and serum-free fatty acids from the fruit here. Its anti-inflammatory activity prevents the conversion of testosterone to dihydroxy and androsterone, the DHT, and prevent the degeneration of prostatic epithelial cells, which is similar to the efficacy of finasteride. Prostate cancer, specific to men, is a chronic cancer. Here you go, and it's a tumor, it's a prostate, and here's the tumor. Obviously, it can impinge on your urethra and cause similar symptoms to BPH. As you age, your chances of developing prostate cancer also increases. In Asia, few patients are diagnosed with the disease at an early stage because we tend not to investigate early and assume. Early detection of prostate cancer improves the chance of a positive outcome. Prostate cancer and selenium. I'm not supporting selenium in any way, but if you go to pharmacies, maybe there will, the two common things that will introduce you is selenium and lycopene. From multiple studies to find out why, many researchers have found more and more evidence that taking selenium perhaps can help men fight prostate cancer. In fact, according to a report in the International Journal of Cancer in February 2003, high levels of selenium in the blood of 445 American men reduced their chances of developing prostate by about 30%. How does selenium protect the prostate? The reason is that it can control the selection of cells with damaged DNA and help the cancer cells die. You know, cancer cells, once they are mutated, they don't know how to die. So this one will help the cancer cells die, or a process called apoptosis. Normal cells go through growth, aging, and death, right? Death means it's programmed to die at a certain age. But cancer cells do not know how to die naturally. In the process called apoptosis. If the normal suicide mechanism in cancer cells can be restarted, cancer cells will be unable to do evil. In an animal experiment, a program that causes cancer cells to commit suicide or cellular self-destruction was increased after increasing selenium supplements. Prostate cancer and lycopene. Lycopene is a natural antioxidant found in many vegetables and fruits. It has the effect of reducing the risk of prostate cancer. A recent study conducted in Harvard on lycopene, the red pigment from tomatoes is an extremely energetic carotenoid and an effective nutrient that helps prevent prostate cancer. This again supports the important evidence that carotene can help prevent DNA damage to prevent the formation of cancer cells. Testicular cancer, again specific to men. In fact, one of my friend's son just died from testicular cancer 2 years ago, and he's not even 30 years old. There's another below the belt cancer that affects men, and this one is more common among younger crowd. The good news is it's very treatable, and when detected early. Taking 2 minutes once a month to do a self-exam of your testicles is recommended to check for anything unusual. So you just cup one testicle, okay, using both hands, familiarize your own testicles, okay, examine by rolling the testicle between the thumb and the finger, okay, and familiarize yourself with the spermatic cord and epididymis, and feel for any lumps or any irregularities, any changes over time. Yeah? Lung disease. We all know men smoke more than women, and if you have a history of smoking, this is an area of concern. Puffing on cigarettes or other tobacco products elevates your risk for lung cancer and chronic obstructive pulmonary diseases, which includes life-threatening conditions such as emphysema and chronic bronchitis. I mean, it's very bad to see those emphysema patients. They are puffing and they're blue and they're on oxygen. Early detection of respiratory illness and various treatments can help minimize long-term effects. And if you smoke, breaking the habit is the best thing you can do to your health. Fourthly, liver diseases. Men are more likely to drink heavily, okay, than women, leading to alcohol-related liver disease, hospitalization, whether it's due to fighting, falling down, or liver disease, and mortality. And scripture says, do not get drunk on wine, which leads to debauchery. Instead, be filled with the Spirit, as in Ephesians 5:18. Gut health. Men often eat more unhealthily due to a combination of social gender roles where meat and high calorie foods are seen as masculine and less emphasis on nutritional education compared to women. I mean, you see a lot of my friends, they go to Klang, they wall up 2-3 bowls of bak kut teh, not just one, you know. And even nasi lemak, how many portions, and they sort of like, oh, feel proud about it. Other factors include higher metabolic needs. Okay, definitely men has higher metabolic needs. They consume on average 500 calories more per day. Less concern about weight management, emotional eating, and a preference for high-fat, high-flavor foods. As a result, colorectal cancer is the third most common cancer diagnosed in men. Risk factors include age, okay, family history, a diet high in red and processed meats, lack of physical activity, obesity, smoking, and heavy alcohol consumption. Regular screenings such as colonoscopies can detect precancerous polyps at all early stage cancer when treatment is most effective. So early detection is key. So if you had a family history of colonic cancer, your father or uncle has had it, maybe in your 40s you should actually have a scope to check for any suspicious polyps or lesions. Adopting a diet high in fiber, okay, lowers the risk of colonic cancer. Fruits and vegetables, limiting red and processed meats, and maintaining a healthy weight can lower the risk of colorectal cancer. The gastrointestinal system. Good bacteria and bad bacteria have been recognized over the last century. Good bacteria are very important to gut health. Modern fattening diets high in sugar messes with our gut, especially for men, because the way they eat and the way they drink. It causes gastrointestinal disorders and several systemic degenerative diseases such as arthritis, dark spots, migraines, allergies, and autoimmune. Our digestive system degenerates. Commonly 45 onwards, it starts degenerating because of the food that we eat, processed foods, etc. Evolves a slower gastrointestinal motility. That's why you get constipation. Reduce enzyme production. That's why you don't digest food as well. And weaken tissue strength. This often results in chronic constipation, nutrient malabsorption, because your lining and the villi of the intestine are not as good, right? Increased lactose intolerance, acid reflux, all that drinking, and decreased esophageal strength. As we age, our digestive system degenerates and our digestion and absorption have gradually deteriorated. Therefore, serving some bioenzyme supplements can increase the digestion and absorption function in our stomach. These enzymes come from natural green plants, etc., like papaya even, right? So, plenty in the market. Today's high level of food processing makes it difficult for us to consume 30 grams of fiber a day. That leads to a lot of gastrointestinal problems. Our bowels become lazy and dirty, causing changes in bowel habits and increasing our chance of developing bowel cancer. Our intestinal tract is colonized with nearly 400 species of microorganisms weighing about 2 kilograms. Among them is a group of bacteria which offer protective and nutritive benefits to good bacteria. Okay, this doesn't protect it from bad bacteria colonizing, but it actually has metabolic, it produces amino acids and so forth, which is essential for gut health. Main function of a good bacteria is to prevent the bad bacteria colonizing, but it has many, many more functions than that. The dirty dozen, the 12 causes of bacterial imbalance in your intestinal tract. Excessive sugar consumption, very easy to identify. Excessive yeast consumption, antibiotic usage, stress, chlorinated water, processed food, red meat, rich fatty foods, excessive alcohol consumption, colas and carbonated beverage, overseas travel, anti-inflammatory drugs, and painkillers. Every culture have their own fermented foods for gut health. Why? Important for what? For promoting the good bacteria, the environment for the good bacteria to thrive. It's like the Westerners have water kefir, yogurt, right? Sourdough bread. Chinese have the ham choy sauerkraut, have the chow tofu, and many, many other things. Japanese have the natto, the miso pickles. The Koreans have the kimchi. The Indians have their lassi tea. Okay, these are all promoting. They promote good bacteria to thrive. Fiber foods are very important. I've already mentioned in many talks. So, yeah, to clear the gut. Okay, you don't want all your food, all the things to be rotting there, especially those red meats and all that. Okay. And moreover, 70% of your immune system is found in your gut. GALT, gut-associated lymphoid tissue. So, 70% of your immunity is in the gut. Okay. This is a test, a biotech test you do to see whether you have the right mix of good bacteria or not. Okay, in your gut. It's called a 16S ribosomal RNA test. Gene sequencing is a method used to identify and classify bacteria, particularly useful for identifying bacteria that are difficult to culture. I mean, you can take your poo, but some of them are very hard to culture in the lab, right? So, but this one just doesn't matter. Just a bit they can of their DNA they can detect already. Or when traditional method fails, it analyzes a specific region of the bacterial DNA, the 16S ribosomal RNA gene, okay, to determine bacterial species and assess and to see what kind of microbiodiversity you have, whether you have the right mix of good bacteria or not in your gut. If you don't, they can do something called FMT, fecal microbiodata transplantation. It is the administration of a solution of fecal matter from a healthy donor into the intestinal tract of a recipient in order to directly change the recipient's gut microbial composition and confer a health benefit. That means if they test that your bacteria mix is lousy, they will get a donor who has a good gut bacterial mix, get their poo, and then administer a solution of fecal matter to you, right? Yeah, just shove their poo into you. So this will transfer all the good bacteria to your gut. Okay, it's called FMT. Okay, in people who live past 100 years old, they found that there are 4 bacteria that's in these people who live past 100 years old.
Is there something in the gut microbiome in superagers, 100 and above, that pop out as important? Turns out there are 4 bacteria that are standouts in people that live to 100 and beyond. One of them is called Odorobacter. One of them is called Oscillobacter. One of them is called Cristin Sinella. And then the 4th one is our old friend Akkermansia.
Okay.
And we've talked about Akkermansia before.
Okay.
Gut bacteria talks to your immune system. 70% of your immune system lives in your gut. And so you've got the right bacteria. They know how to speak the right language to your immune system to tell it to do what it's supposed to do.
Age-related testosterone decline happens with males. Male menopause. Testosterone levels naturally decline with age, affecting libido and erectile function. Low testosterone is also associated with increased arterial stiffness or arteriosclerosis. Okay? Age-specific population centiles for androgen status, as you can see, goes down with age. Testosterone is formed in the testes. Okay, of course, the pituitary gland in the brain releases luteinizing hormone to the testes, and then you produce testosterone. Testosterone is a hormone produced by your testicles that may play an essential role in your sex drive, sperm production, muscle growth, bone growth, hair growth, voice deepening, and red blood cell production. Having low testosterone doesn't necessarily require treatment. There are guys who feel completely normal and may not want an intervention. Only treat if you're symptomatic. You may be offered testosterone replacement to correct a hormone deficiency, which you should relieve your symptoms. I mean, you need testosterone for muscle growth, to maintain your bone strength, and definitely, if you're low in testosterone, Viagra and all these are not going to work, right? Because you need testosterone to condition your sexual organ. So the treatment is often given as an injection, okay, or a gel. Oral absorption is very poor due to high first pass metabolism by the liver. Other ways to boost testosterone: eating a healthy, balanced diet with good proteins and whole grains, cut down sugar and alcohol, stress control, exercise, weights. Okay, you need resistance training, right? Like weights, or hit high intensity interval training, or just join a high rocks training. Adequate sleep is important. And stress will kill your testosterone, because when you stress, you see, if the cortisol increases due to stress, your testosterone level drops, right? So trying to manage your stress. Sleep is important. Most of our testosterone is produced when we are in the deep REM sleep. This is why our testosterone levels peak when we wake up in the morning, and are lowest right before sleep. Okay, there you go. Correlated to the amount of sleep you have, your testosterone increases. That's why when you wake up, there's a royal salute. Yeah? There you go. If you sleep 5 hours, you produce about 40% less testosterone compared to someone who sleeps 7 hours. So have a long sleep well. Okay, number 7, longevity and erectile dysfunction. I mean, most men are living longer, so the prevalence of erectile dysfunction is increasing. 8% of men in their 20s experience ED, 11% of men in their 30s, 40% in age 40, 50% in men age 50, 60% of men age 60, 70% of men age 70. And by 75 and beyond, nearly all men have at least mild erectile dysfunction. This increasing prevalence with age occurs because the physiological processes that cause ED, like arteriosclerosis, okay, blocking of the blood vessels, in older men begins much earlier in life. Symptoms of ED include being able to get an erection sometimes, but not every time you want to have sex. Being able to get an erection, but not having it last long enough for sex. Or being unable to get an erection at all, at any time. Okay? So ED is often a symptom of another health problem or health-related problem. So it doesn't happen in isolation. So due to aging, ED is not an inevitable consequence of aging, and understanding its relationship with longevity can help men maintain both sexual health and overall well-being throughout their lives. There is instead a strong evidence linking ED with a number of medical conditions. Vascular. The narrowing of the arteries called arteriosclerosis is one of the most common causes of erectile dysfunction. In fact, 80%, right? So the arteries in your heart is 4 millimeter. The artery in your penis is 1 millimeter. So by the time you got heart symptoms, then most likely you already have some sort of erectile dysfunction, right? Neurological, that can be due to accidents, nerve problems from diabetes, endocrine, right? Endocrine problems. So it's important to check your hormones. Psychological, maybe anxiety, performance anxiety. Treatment of ED. Basically do the basics first. Quit smoking and drinking, or limit drinking. Lose weight and reduce cholesterol. Increase physical activity to increase your overall blood flow. The oral medications like Viagra, Cialis, sex therapy, penile injections, like Eprodistal, vacuum device, intrauretral medication, surgery, a penile implant. These are the whole works. Doctor's treatment, oral medications, you're familiar. Vacuum erection devices, okay, you can just put a restriction device on the base of your penis, do a vacuum suck, then you remove the vacuum, then you can have intercourse. Injection of Eprodistal, a vasodilator, penile implant. You can put a penile implant and then you inflate it, right? Like as required, it's like inflating a tire. Oral medications includes sildenafil or Viagra, tadalafil, Cialis, Avanafil, Stendra. If they don't work, in patients who are unresponsive to on-demand Cialis, that means when you need it, you take the Cialis. Treatment with daily Cialis significantly improve all treatment outcomes. Successful intercourse increased from a mean of 21% with on-demand Cialis to 58%. That means in these patients, only the 20 mg of Cialis only work 21% of the time. But if they add on a daily Cialis, okay, 10 mg, then the success rate with on-demand Cialis increases to 58%. Why? Because that means your blood is perfusing your penis throughout the day, all the time, not just when you need it, right? So perfusing all the day is good, all the time is good because you give it blood flow, give it nutrients, okay, to the penile tissue. So try Cialis 5 to 10 mg and then take 20 mg Cialis on demand. Okay, try for 12 weeks or alternate day Cialis 20 mg. So get the penis oxygenated and perfused throughout the day, not just during REM sleep or when you're on demand needing it. Okay, this is the study: efficacy and safety of daily tadalafil in men with erectile dysfunction previously unresponsive to on-demand tadalafil. So they weren't responsive, but after taking daily Cialis, when they took the on-demand 20 mg Cialis, the success rate went up to 58%. Herbs for ED, maca, okay, a vegetable root from Peru, but not much scientific evidence. Panax ginseng, some studies. Yohimbine, a West African tree bark believed to release nitrous oxide and dilates the arteries for to the penis. Nitrous oxide mechanism is how Cialis, Viagra all work. Studies on the effect of yohimbine have mixed results. Okay, you go to the European sex shops, you find a lot of yohimbine. Okay, combination of yohimbine and L-arginine is shown to significantly improve erectile dysfunction in people with erectile dysfunction. L-arginine is an amino acid that helps expand blood vessels. It's also for bodybuilders. L-arginine is an amino acid which is a building block of protein. It's a vasodilator, which means it can help open up blood vessels. In theory, this could increase blood flow to the penis and help produce an erection. A study from reported that many people with ED had low L-arginine levels, which suggests the two may be linked. However, scientific studies have not proven that taking L-arginine supplements can treat ED. Tongkat Ali, a Malaysian herb, right? What it does is that it stimulates testosterone production, but over time, and not instant. So you need to take it for months before your testosterone is increased. Okay, so smaller studies have found Tongkat Ali herbal extract to improve sexual health and have positive benefits for erectile dysfunction. The compound could act as a testosterone booster for low testosterone and treat these issues according to clinical studies. Horny goat weed. Some men take horny goat weed in the belief that's a natural alternative to drugs to ED. Although still preliminary, there's new evidence to support the idea. Epimedium, the suspected active compound of horny goat weed, appears to increase blood flow and improve sexual function, or act as a PDE inhibitor, similar to drugs like Viagra, that's used for ED. Horny goat weed also contains phytoestrogens, chemicals that act somewhat like a hormone estrogen. New treatment approaches, combination therapy, using a PD5 inhibitor like Viagra, etc., okay, with other agents to enhance their effectiveness in older men, right, like Tongkat Ali, or eprodiol injection with PD5 inhibitors, right, you inject. Or you can try low intensity shockwave therapy, or EWST, to clear the blood vessels from blockages. This non-invasive treatment uses sound waves to improve blood flow by stimulating angiogenesis and may help restore smooth muscle function. 6 to 12 times, 20 minutes each session. You just like go twice a week. Okay, you'll be over by about 2-3 months. Repeat every 3 to 5. Yeah, and this shockwave therapy is endorsed in the clinical practice guidelines for management of erectile dysfunction in the Malaysian guidelines for mild to moderate ED. This is how it works. To stimulate the smooth muscle function and to clear the vascular blockages. It doesn't hurt at all. It doesn't hurt at all. Okay, secretomes or exosomes and PRP. So I prefer secretome mixed with PRP. Take your own PRP, 3 meals. Get secretome, 3 meals. Mix it. So four spots, 1.5 mil, 1.5 mil. Each spot, 4 spots. 2 on the left, 2 on the right. Secretomes derived from stem cells and platelet-rich plasma are emerging regenerative therapies for erectile dysfunction that offer potential benefits beyond traditional treatments. It regenerates tissues. I mean, like any tissue, whether it's a female sexual organ or male sexual organ or any part of your body, it degenerates, right? So this regenerate new tissues. Whereas the shockwave one causes blood flow to be restored. Okay, so it's good to combine the shockwave with all these secretome and PRP injections. It's called the P shot. Secretomes lacking cells are often cell-free products containing growth factors that promote tissue regeneration and are less risky and more cost-effective than stem cell therapy. PRP, rich in growth factors, also show promise in stimulating tissue regeneration and improving erectile dysfunction. So where do you inject it? Intracavernoso, the corpus cavernosum. There you go. It's called a P shot, priapus shot, non-surgical, and it's about 30 minutes. Most of the time, because why it takes time to spin the PRP, but it's to make sure the local gel anesthetic has has taken place, right? After 5 minutes, it still won't work. Injecting PRP to the patient's own blood into the penis to improve erectile dysfunction, but it's good to mix it with secretome or exosome because it will help regenerate all the organ, not the penile organ. Injuries and risk taking. Men are more disproportionately affected by road accidents and workplace injuries. Young men, especially vulnerable to risk taking behaviors. I mean, I can recall myself being very, very naive and risk taking when I was younger. The scripture says, "The prudent see danger and take refuge, but the simple keep going and pay the penalty." Proverbs 27:12. So, whatever happens, we have victory in Christ as men. Health stewardship with an eternal perspective. Okay, we just in this body temporarily, but guarded while we're here. It's a temple of the Holy Spirit, and I can do all things through Christ who strengthens me. Okay, you need to be active, right? I just came back from High Rocks, Bangkok a few days ago, so it's a new sport to me. It's cardio plus a lot of resistance and muscle, so it's good because why? I find a lot of movements in High Rocks have anti-aging elements, right? Cardio for sure, muscle strength, flexibility, and proprioception. So it's very, very good. So nothing is impossible as long as you have Jesus. God bless. And thank you for listening.